Hi, my name's Dr. Thomas Kropp, and if you're watching this, you're considering or actually planning to have upper eyelid surgery to correct your droopy upper eyelids. Droopy upper eyelids is called ptosis. A common question a lot of patients ask me is, who should do my ptosis or droopy eyelid surgery? A plastic surgeon or an oculoplastic surgeon? Generally, an oculoplastic surgeon has extensive experience and training in eyelid surgery, and if he's a member of the American Society of Ophthalmic Plastic and Reconstructive Surgery, he's board certified in ophthalmic surgery and has 1 or 2 years of surgical training dedicated totally to the eyelids. There's a number of reasons you may be considering to have your droopy eyelids repaired. The most common is because they're functionally interfering with your vision. This may entail blocking your peripheral vision, or may actually obstruct your vision to the point where you have to tilt your head back to see. Sometimes it's done for cosmetic purposes also. The causes of droopy lids is generally a weak or stretched muscle that raises the eyelid to open the eye. This requires that the surgeon go in and tighten the muscle. Extra skin or dermatochalasis can occasionally get so bad that it overhangs the lashes and blocks the vision. Most frequently, it's a combination of the two, a weak muscle and extra skin. The procedure is done as an outpatient in our ambulatory surgery center. You're asked to arrive 60 to 90 minutes before, and the procedure takes about an hour. You're in the recovery room 30 to 45 minutes after surgery. General anesthesia is generally not used except in very young or small children. Local anesthesia with sedation has a number of advantages, but primarily allows you to be awake for most of the surgery, and I can adjust the lid height to get the proper height, contour, and curve. I may sit you up 1 to 5 or 6 times during the procedure to make sure we've got a symmetrical result. The surgery basically entails numbing up the upper lid with a small amount of local anesthetic while you're briefly sedated. We then take you to the operating room and wash your face and drape you so that just the eyelids are exposed. We make an incision in the eyelid crease, dissect down and find the muscle that raises the eyelid. We take a couple tucks and then sit you up and in the sitting position adjust the height. When I get it in an acceptable position, lay you back down and close the wound with sutures. Before surgery, you will receive detailed instructions that include stopping aspirin and other antiplatelet meds like ibuprofen. Coumadin and other blood thinners also need to be stopped before surgery, and if necessary, we will ask you to get medical clearance for this from your family doctor or cardiologist. You'll be asked to cleanse your face with antibacterial soap the night before and the morning of surgery. After surgery or post-operatively, you'll be asked to use cold compress, and this is important for the first 36 hours to minimize swelling. We will start them in the recovery room and ask that you continue at home at least 15 minutes out of every 60 minutes while you're awake. The types of cold compresses may range from just a mixture of ice and water that you rinse a washcloth out and place over your eyes, to the commercial gel packs you can buy at the pharmacy and keep in the freezer, or even a bag of frozen peas wrapped in a wet washcloth. You will be given a prescription for an antibiotic ointment to put in the eyes, mostly to keep them lubricated the first few days after surgery, and you'll be instructed to use this 2 or 3 times a day for the first 2 days and then nightly until seen in the office. It's okay to use your artificial tears also as needed. Taking a shower the day after surgery and shampooing your hair is perfectly okay, and the eyelids may get wet. Just be sure to just gently dry them and don't scrub them. Most of the time we use absorbable sutures, but occasionally I feel it is better to use non-absorbable sutures, and if this is the case, we will take them out 7 or 8 days after surgery. After surgery, we'll ask you to keep your head elevated for the first 36 hours. This helps minimize swelling. During the day, sitting in a chair, avoiding bending, and then sleeping on at least 2 pillows at night. Light exercise like walking is okay the day after surgery, but I generally ask you to resist strenuous activity for 7 to 10 days and avoid bending also. Other specific instructions will be given to you at the time of your surgery. A lot of patients are concerned about pain after eyelid surgery, and fortunately, it's generally quite low. Extra strength Tylenol every 6 to 8 hours is usually more than enough. for pain relief. However, if you feel something stronger is necessary, I can give you a prescription after surgery. It's okay to resume your aspirin products the second day after surgery. With regards to Coumadin and other blood thinners, we'll give you specific instructions, but it's generally okay to start by the morning after surgery. Eyelid surgery, like any surgery, entails risks, and a few of the more important ones include visual loss, which fortunately is extremely rare after eyelid surgery and is usually a result of putting pressure eye patches on the eye. Because of this, we encourage cold compresses and do not patch the eye after surgery. Dry eyes can also be a problem. If they're severe before surgery and to the point where you're having a lot of problems, I may tell you not to have your eyelids raised, as this would only make your dry eyes intolerable. We do expect your dry eyes to get slightly worse, at least temporarily, after eyelid surgery because your eyes will be more open. This may entail using a lubricating ointment at bedtime for a few weeks to a few months after surgery and an increase in your artificial tears. As in any surgical procedure, infection is a possibility. Fortunately, this is rare because the blood supply is so good. Of course, the downside of the good blood supply is bruising. This is variable in most patients, but expected. It generally resolves in 7 to 14 days after surgery. Another complication is overcorrection, raising the eyelids too much. This is part of the reason you're awake for the surgery and that I sit you up intraoperatively. Sometimes the muscle may be too weak to raise the eyes adequately and still allow you to close your eyes completely. If this is the case, I will use my judgment and raise them to the safest level I feel possible. My philosophy is to be conservative. We can always go in and do a little bit more, but to try to lower our eyelid that the muscle was tucked too much or too much muscle was removed is extremely difficult and frequently results in a poor cosmetic outcome. If we do need to do a little bit more surgery, it's usually done as a minor operation in the office at no additional cost. A frequent question patients ask me about their droopy eyelids is, will Medicare or my insurance cover it? Unfortunately, it's important to understand that Medicare and increasingly more and more insurance companies will not pre-approve droopy eyelid surgery, and they put some of the risk financially on the patient. We will discuss this further with the surgical coordinator, but basically, they will not review any of our tests before surgery. They require us to get a visual field to show that your droopy lids are blocking your vision, and external photos documenting the droopy lids. But Medicare and increasingly more insurance companies are asking for a third document called an advanced beneficiary notice that basically states that the patient wants to have the surgery and they're willing to pay for it if their insurance company or Medicare denies the claim. Unlike a lot of doctors that then look at this as the ability to charge whatever they want, we generally only hold you responsible for what Medicare or your insurance company would have approved to pay for the surgery. Ptosis or droopy eyelid surgery is generally very rewarding to the patient and the surgeon as long as it's performed by a surgeon with significant experience. I look forward to the privilege of being your surgeon. Thank you for taking the time to watch this presentation.